Greetings to everyone. A warm welcome to our viewers of PhysioTV. Today we'll be going ahead with a panel discussion. On behalf of the organizing team, I extend my warm welcome to all of you for today's panel discussion. We have with us very eminent panelists today, starting with Potiraj sir. Potiraj sir is currently heading the community department of KJ Somaya College of Physiotherapy. Sir has keen interest in working with elderly population for fall prevention and community outreach programs. We welcome you, sir. Our
Thank
second
you.
panelist is Dr. Anu Arora, ma'am. Ma'am is heading the community department of DY Patil Navi Mumbai College of Physiotherapy. Ma'am is also a PhD guide. We welcome you, ma'am. Coming to our third panelist is Dr. Suroshri, ma'am. Ma'am is proudly heading the community department of Sancheti Institute for Orthopaedic and Rehabilitation College of Physiotherapy, Pune. We welcome you, ma'am. Coming to our last panelist, Dr. Benazir Patil, ma'am. Ma'am is currently working as the CEO of Society of Community Health Oriented Operational Links, that is SCHOOL, which is an NGO which is devising on innovative concept of community-based service delivering mechanism. We welcome all our panelists for kindly gracing for today's panel. So without any more delay, we'll go ahead. So my first question is to Potiraj sir. So, sir, as physiotherapists, do physiotherapists sometimes unconsciously or subconsciously set lower recovery expectations for elderly patients, and how, as we physiotherapists, can address those issues?
Okay. Before we jump into the discussion on this question, I would like to congratulate the team of Sancheti Physiotherapy for initiating such a wonderful need of the hour of this topic on how the ageism is happening currently in healthcare system. And I take this opportunity to thank Dr. Shimpi sir and his entire team, Surosh and his team, for this wonderful organization of this panel discussion. Coming back to the question, or does it happen? Yes, very much. 100% it is happening subconsciously. It is not that intentionally that somebody want to underestimate the progression of the elderly, but it is happening. Why it is happening? If we try to understand why this is happening, there are few reasons I could think of it. One, there is a stereotype about elderly. When any elderly walking into OPD, the therapist mindset such that okay, people are the elderly and they have a frail elderly, so they may not have the capacity, they have a less capacity, there's a lot of assumption, and that is happening that they cannot do, and they are less motivated and it will be very difficult. So that is one aspect. And secondly, if you think also as a experienced therapist, maybe that therapist is working with elderly and who have recovered very slowly, and therefore the program, the set protocol is substandard to that patient. Then based on that experience, the therapist will automatically advocate when you see the next patient, thinking okay, all the elderly likely to behave in a similar manner, and probably I need to go through the safe pathway. That could be the another reason why there is underestimate of the protocol. And third one is time and resource constraint. Obviously, when elderly walking in as against a younger patient, everybody prefers younger was against elderly for one reason. Elderly have a lot more complications in their health, and there's a lot more to share and lot more to treat. It's a time consuming. So as given an option, a therapist would choose to treat younger population as against elder. Therefore there is the everything is subconsciously it is like what to say, they set lower recovery expectation as whenever they want to address the elderly. How to address this and how to overcome this problem? One, obviously we need to, there is a academic curriculum in place, but still we need to emphasize in the clinical setting, where we need to create awareness and training on the junior therapists, how each individual elderly will demonstrate a different set of issues, and it's not the same. It's maybe osteoarthritis, a condition may be the same, but each and every individual will demonstrate differently. Therefore, that need to understand that in the clinical setting, where the senior physiotherapist or as an academician, we should be able to guide those junior therapists or the learning physiotherapy students to recognize those changes, those variability in patient. That is one that I can think of. And second one is patient-centered goal setting is also very important. As we all are aware, we take a elderly assessment is very extensive, very exhaustive, and at the end of the assessment, then the junior therapist or the physiotherapy student, they start generalizing the goal. This is what I want to achieve. This is what I want to do for this patient. But does this matter? No. What we need to look into is taking the patient into the into the decision. Person-centered goal setting has to be achieved. What your patient wants to achieve, what is his goal? He has come to you with certain impairment, certain problem. What the patient want to improve? Probably as a therapist, we may want to think in terms of reducing pain, improving range, but the patient will say, I won't be able to go back to kitchen and do my cooking. I won't be able to go out of the house and do certain task. I should be able to socialize, should be able to participate in social activities. The goals are different. So when there is a mismatch and there is a expectation also differs. So rather, I would say uh, person-centered goal setting is very important, and therefore the focus has to shift on the function, okay, as well as the motivation of a patient and the context from where the patient has come also plays an important role. Without just focusing only the physical impairment alone, not going to help to recover faster. What happens if the patient is not motivated? But he has come to you and you're working hard, then the patient may not be able to show the recovery as expected unless you touch on those motivation aspect. So that's also the focus should shift to function and motivation and the context where they come from. That has to be focused. And another one is very important one, which I highly recommend, is evidence-based practice, which is also very important. So we have to highlight to the students, physiotherapy students, what research works best for the elderly, which are safe, which are significant, which is focusing on improving the functional goals rather than focusing on impairments. And next one is another way that we can overcome this barrier is reflective practice. Okay, elderly, as I said, each elderly has a different, unique set of problems. So when they come, the junior therapists or the physiotherapy students will get confused. Am I in the right way? Initiating a goal, initiating a treatment plan. So when in doubt, do not hesitate in have a peer discussion, have a reflective practice in your goal setting. This is what the patient has come to me with a particular problems. I'm planning to initiate a set of this program. Is this right? Is this suitable for this patient? Is it safe for the patient? Can this safe, suitable program can help to recover faster to overcome those problems? That has to be should be focused. So these are the possible things I can think of overcoming this problem.
Thank you so much, sir. We'll move to Suroshri, ma'am. Ma'am, our question is, what role do experienced physiotherapists or mentors play in shaping young professionals' attitude towards aging and elderly care?
Thank you so much, Shivani, for the question. So, when you say role modeling, it has a lot of responsibility. So, as experienced physiotherapists, it is very important that they or we work as mentors. We explain them that aging is not just about one-time experience. It is an experience which is going to be there from for a certain period of phase, and it is probably going to be there mentally, physically, sometimes socially also. So cultivation of empathy is something which I feel as mentor or as a role model, as senior physiotherapists, where they can play a primary role as, because respecting the ageism and respecting the changes and understanding the um, whatever changes or how we will tackle that, how we will be able to manage that as part and parcel of physiotherapy practice. So that is something which can help the younger professionals which the senior professionals can guide through experience. And not to forget that there are specific clinical skill sets. There is a major important component of patience, and a lot of it depends on the cultural sensitivity which comes with management or practice of geriatric physiotherapy. So that is something which probably the senior professionals can mentor the younger professionals while they are training them under their supervision. And lastly, I would say that the three things, that is the positive role modeling, which I think even Pothiraj sir mentioned, exposure to evidence-based practice, and not to forget inclusive teaching, that we have to shift our attitudes from ageist biases to more inclusivity. And only then the even the elderly people will be valuing, and they will be more active participants in their own for their own health benefits. So I think these are the few pointers which senior professionals can guide and mentor as role models to the younger professionals. Thank you.
Certainly, ma'am. Thank you. I think my next question to Anu ma'am is very much in aligning to what Potiraj sir and Suroshi ma'am has said. So, ma'am, how can physiotherapists empower elderly clients to advocate for their functional goal and independence?
Good afternoon, everybody, and thank you for the question and thank you for organizing this panel discussion. I think the answer points to the problem which lies there in the question, that there is a need for advocacy. You need to advocate for the elderly people to believe that they can get functional goals, they can achieve functional independence. And why is it coming? Because the term ageism itself is bringing that stigma. We have a stigma associated with age. So that is the first problem that we need to overcome if we have to get our elderly to have their goals set at functional independence. So let us stop using the term ageism because it brings a prejudice that as age advances, there would be disability. Now, as the average life expectancy is increasing, we no longer are non-functional at 58, which is the average retirement age in our country. So first and foremost, we all need to come over it that aging is a biological phenomena. What happens with the system is a decline in optimum function, which is a chronological event, and it can be reduced, not nullified absolutely. That is very, very important. That aging is inevitable, but suffering is something that we can alleviate. We can help you to live a functional, comfortable, independent life. First, we as healthcare professionals have to amalgamate this, assimilate this fact. And secondly, when I move out into the society, this is the message that I need to dissipate into the society by creating an awareness that there is biological aging and there is successful aging. The concepts have to be dealt with. Now, once you create that awareness, they themselves would set goals for themselves which are aligned with their aspirations. And there will come the role of the therapist to meet these patient centric goals. And now when they have these goals, now I need to motivate them to achieve the goals. So how do I do that? I get the community to encourage them, to facilitate them in the achievement of these goals. I get the family to be involved when these people work towards these goals. And then there is also the need for the elderly to improvise upon, to strengthen upon their communication strategies. Because I firmly believe that आपकी सेहत जो है वो आपकी आवाज में छिपी है. जब तक आप आवाज नहीं करेंगे मुझे ये चाहिए तो आप वो पा नहीं सकेंगे. This is like going with a ship without an oars. It is the same thing here. So I need to give them those oars. For that, training them how to communicate their health needs. We often come across patients who say, I went to my physician, he just gave me a minute, he did not hear my complaints properly, did not address them. So where was the problem? He has his own goals. And I, as a healthcare professional, had my goals in mind. This is what I want to achieve. So getting into function, getting into quality of life, beyond that, getting into patient-centric goals would encourage the elderly people also to approach us for our help to achieve those goals. So that is what I think there needs to be a mass movement which helps to create awareness about what does aging ensue and what all can be achieved beyond pain, beyond suffering. So it is about leading a healthy life till the time you have breath in your.
Thank you so much, ma'am. Coming to my next question will be to Benazir, ma'am. Ma'am, how can we design services and rehabilitation spaces that are more inclusive and that are more welcoming as well as respectable towards our aging clients?
Yeah, thank you. I think all the other three panelists have spoken about it. And to tell you the truth, when we actually designed this program, developed Vridhamitra program, the first thing we kind of realized that the elderly should identify with the program, so that is why it was named Vriddha Mitra. So they are friends of older people, and any language they may be speaking, they should be able to identify. So it's a very Hindi, Marathi kind of Sanskrit name that we developed. And the goal is, the goal of this program is to create an age-friendly ecosystem. So when we say age-friendly ecosystem, we are talking about everything. It's not just the infrastructure, it is our behaviors, it is our attitude, it is our approach towards the elderly and how we treat them and how we serve them. Because at the end of the day, all the services that are designed for them, whether it is rehab, whether it is physiotherapy, whether it is post surgery, care for the bedridden, all of that, we need to have sensitivity. We need to have an understanding about the kind of declines they are going through. So, for example, they have their mobility challenges. So, if we are designing spaces, and then, many times we find that when we talk to Pune Municipal Corporation, they are asking us to start a unit on fourth floor or fifth floor. And the first thing we have to understand whether there is a lift that is functional. And many times we see in the public hospitals, the lifts are not functional. Similarly, what kind of people are coming there? Are there railings? Are there handrails? Is the pathway smooth for the elderly to walk through? So one is infrastructure, but in reality, when we started the program, we also realized that every single person we were hiring had worked with children or adolescents or women, and nobody had worked with elderly people. So we found it very challenging to bring in that sensitivity. So, after about a year and a half, we designed our own course and we started with the Mitra course. It's a 3 months course where we actually create a sensitive, caregiver. We train them. We train them to understand the psyche and, how the elderly thinks and feels. So when we are talking about inclusive spaces, all these aspects are important. How we think, how we relate with them, how we serve them, how we actually treat them when they are coming to these spaces. And at the same time, if you see, when we are looking at hospital setup and various other units where they go for seeking services, at most places there are all age groups that are coming. So it is also very important that there should be communication materials displayed there. I mean, we have umpteen material to display about how to behave with children, how to treat children, how to understand their sensitivity, but we don't have materials of how. And we take it for granted that okay, it's okay, but many times we find that the elderly is walking into the clinic and has challenges, but nobody will get up, you know and we don't talk about it, that what kind of helping hand should be extended, what are the kind of declines they are going through, what is the mental state they are into when they come for seeking a healthcare or rehab service, the kind of frustration they have already undergone. So we have tried a lot, and we Our, today we have trained more than 500 caregivers in Pune. And it's interesting that, first 8-10 days, those students who come, they are in the age group of 18 to 40. They have their own questions. And they sometimes, when we show them the kind of decline that is happening, whether it is related to mobility or hearing or vision, or even the mental well-being challenges, they will say कि अच्छा ऐसे भी होता है, we are hearing this for the first time. So there is that lack of sense of consciousness amongst us. We I mean, of course, thanks to all the efforts and programs and whatever government of India is doing, we are sensitive to children today, but not to the elderly. So I think it's more about, the inclusion is more about the psyche and behaviors rather than just the infrastructure. Thank you. I think we can continue.
So my next question is to Potiraj sir. I think this is the one question I feel I wanted to hear. What are your views, sir? So,
Yes.
is the physiotherapy curriculum sufficiently addressing geriatric care and confronting age bias? So, since most of the universities in India are covering geriatric topic in community itself, but as we go abroad to the Western culture, I think they are taking gerontology as a whole different subject. So, in your view, sir, is physiotherapy curriculum in India sufficiently addressing the geriatric care?
Yeah, it is very interesting question. In fact, the curriculum set by different universities, okay, covers geriatric model differently. There is no standardized protocol. Like when I've done my masters, I have done my masters in geriatric physiotherapy plus gerontology, PG diploma in gerontology. So that was a extensive program that has been offered in few universities. Whereas in currently under Maharashtra University Health Sciences or some other university, if you look, it's very limited aspect has been exposed as part of geriatric physiotherapy in a few deemed universities, like now they started offering geriatric physiotherapy as a specialty program itself, like programs in geriatrics, where there is an extensive aspect, like what Madam has mentioned. What are the psychological problems, social problem faced by elderly? What are the aging process around the elderly are happening or being covered extensively? So under national curriculum also currently it has been very minimally been offered, unfortunately. So we are right now we are just fighting how we can, because this is a if you look at the population, it's a larger population, and the healthcare training programs are minimally exposed even at a PG level. And it has to be, it is a extens it is a s- it's it has to be a separate specialty program, because to study more aspect about elderly and their care program. So currently it is underrepresented in the curriculum in India. And yeah. Can we go to the next question?
Yes, thank you so much, sir.
Yeah.